Hi everyone, my name is Chethana. I'm trying to show an analysis of an AIDS clinical trial data, which I found on Kaggle. So I'm trying to predict two things. That is the CD420 value, which like I explained last week, is the count of white blood cells which gets affected by the HIV virus, which as the treatment progresses should increase. And also the chances of survival. So I tried to use two ML algorithms, linear regression to predict the continuous variable CD420 and a logistic regression to predict the survival chances, which should be categorical. So I started with cleaning my data. So since I had continuous features, categorical features, and also binary features, I tried to normalize it. So I did hot encoding of the categorical variables and scaled the continuous variables. And then I started off with doing a t-test. I found some p-values, and initially I thought I could eliminate of race and gender, which I thought might have contributed, but I found that the p-values are high. So I did not take them. Then I directly did my linear regression with all the features. And immediately I could see that the CD40 value stands out very high, which means the baseline where the CD4 was actually the main factor, which could potentially tell you that, of course, that patient might have a positive outcome to the treatments. Then after I did the linear regression, I tried to plot the residual plot, which is like the predicted value minus the actual value of the feature. And then I could see that the values were scattered around the zero line. And the same values I tried to make a histogram, and that follows a normal distribution, which can mean that the MSc, which we learned in class, will work on this error. I also tried to do a correlation matrix, and then that also came out that the CD40 value is the highest. The R2 score is low, which means that there is a lot of scope for improvement. Then for the label, which is the survival chance, I did a logistic regression. Again, for this too, the factor which influenced it the most was CD4 count itself. This I got an accuracy of 75%. And the low accuracy and the low precision is mostly because of the class imbalance in the data, I think. There were more zero values in the label, which showed survival chances than ones. The outcomes are a sort of clarity on how the CD4 baseline value is impacting the CD420, which is sure from this analysis. Yeah, and this could help in allocating resources in clinical settings, guide treatment decisions, etc. That's all. Thank you.